Good afternoon, and thank you for joining the Office of Early Childhood's webinar, Little Eyes Are Watching and Learning, the importance of practicing what is preached when talking about mental health and wellness. Passing it over to Diana, who will give instructions on interpretation.
Buenos días a todos. Mi nombre es Diana Reyes y daré instrucciones sobre cómo acceder a los servicios de traducción para el seminario web. En la parte inferior de la pantalla, haga clic en el globo terráqueo que dice traducción y luego seleccione español o SP. A continuación, puedes silenciar el idioma original. Gracias por acompañarnos. También las instrucciones están en el chat. Gracias.
Thank you, Diana. And now passing it over to the Commissioner of the Office of Early Childhood, Beth Bai.
Good afternoon, everybody. Thank you so much for joining us, and thanks to the team that put this together. I want to welcome my co-commissioners, Commissioner Navarrete and Commissioner Hill Lilly. We are here representing Governor Lamont, who has this as a priority and has us focused on this since coming into office. But I'm glad everybody's here to say hello and tell you how important this is. Really grateful that Senator Maher is going to be your keynote. She has lived this in her work life and has been a great champion on these issues of mental health and trying to have a more coordinated system. As Commissioner of Early Childhood, I'm really proud of our work on mental health with our home visiting programs, with Head Start, who you'll hear from today, with Birth to Three too. And we really believe that those early years set the foundation for mental health, and that our programs that are out there in the field supporting families with children 5 and under help build a strong foundation that help children who experience various stresses in their lives be able to sustain those without significant mental health challenges later on. But we know we can't always get there early, and despite people's best efforts, there are always going to be challenges that challenge people's. So I guess I saw the title, Practice What You Preach. I'll close with this. It really made me think that
each of us has a responsibility
to support others' social emotional wellness and health, to be supportive whenever we can be, to meet people with respect and with love, and to create caring communities, whether it's 2 people in your office at work, a classroom that you're working in, that we're modeling caring communities, that we're modeling that when we need to take a break, we take a break. And we model those practices in our workplace, at our home, in our neighborhoods, in our schools, in our communities. I always think, I bet you all can think of someone who made you feel seen and heard, and what that did at a time that maybe you were stressed. That this human connection and relationship is so important. So I'm grateful for the presenters, and I hope you have a good workshop. And Lorna, are you going to turn it over to somebody else now? Assuming maybe I should know who I'm passing it to, but I'm going to go back to Lorna, our fearless leader on this workshop, and have her pass it on next. So best of luck with the webinar.
Thank you so much, Commissioner Bai. And with the wonderful leadership that you have as Commissioner, we are so thankful and honored to also have Commissioner Jody Hill Lilly with us as well, who is the Commissioner of the Department of Children and Families. And so with that, passing it over to you, Commissioner Hill Lilly.
Good afternoon, everyone. It is my absolute pleasure to be with you all today and in great company of my co-commissioners, Nancy Navarrete and the wonderful Commissioner Beth Bai. What you see here is a great sign of collaboration and evidence of collaboration. We work very well together. This is not a show. I really have a great deal of admiration and respect for these co-commissioners, and we are working together on behalf of our kids and family. And we're so grateful to be in partnership to support this webinar by the wonderful leaders and under Lorna's guidance to be able to have this important conversation today. Their little eyes are watching. I mean, it's such a great title, and really a message for all of us that we need to practice what we preach. You can't just talk the talk, you got to walk the walk. And that means that for even for all adults, including ourselves, taking care of our mental health is so critically important. And I say this everywhere I go. I too have a therapist, and I think it's really important for all of us to see health and mental health all in the same sentence. So we appreciate that, and our kids are watching. And to Commissioner Bai's point, we really want to start as early as possible, which is why during my administration, one of the things I did was to focus in on that 0 to 5 population, and to make sure that we are giving them the best shot early on in their lives. So I appreciate this partnership more than ever. And more importantly, I would beg you all to do exactly what the title says, and that is practice what we all preach by taking care of ourselves and being our best selves so that when we talk to others and encourage them to do so, that we are doing it with authenticity and that we are demonstrating and modeling that taking care of ourselves. And lastly, I'd like to close with just saying how much I admire, appreciate, and respect our keynote, who is very passionate about this title. As a legislator, as a legislator, she is very committed to these practices around early childhood, and she holds us all accountable and supports us all at the same time. So you're going to have a wonderful time with this webinar and all the speakers that are here, and just enjoy yourselves. And again, live out that practice in what we preach. So have a great webinar, and I'll turn it back over to you, Lorna.
Thank you so very much, Commissioner Hill Lilly. It's always an honor to be able to partner and collaborate with you, and thank you for your unending support. And with that, we are so thankful also to have with us Commissioner Nancy Navarrete, who is the Commissioner of the Department of Mental Health and Addiction Services. And we are so honored for your teamwork and collaboration as well. Passing it over to you.
Thank you so much. Good afternoon, everyone. My name is Nancy Navarrete, and I am the Commissioner of the Connecticut Department of Mental Health and Addiction Services, or DMAS. Shout out to my co-commissioners who are great partners in this work. I'm really grateful to be part of today's webinar to recognize that mental health matters to everyone, regardless of age, background, or identity. DMAS has really capitalized on Mental Health Awareness Month, which is May, to promote the importance of helping individuals and families feel comfortable accessing services and supports, as well as helping children, adults, seniors understand that asking for help is a strength, which will build what we call recovery capital for future success. Leading these conversations about mental health and wellness with a non-judgmental sense of empathy and non-stigmatizing language really paves the way for healthier communities across multiple generations. DMAS has been a national leader in recovery-oriented care for decades. You might ask, what does that mean? Simply stated, we build recovery around strengths and build recovery plans driven by the goals of the individuals that are seeking our services. It's DMAS's vision for our system of care to be individualized and culturally responsive in a way that is sensitive to trauma, which is one of the underlying contributors, right, to what we see exhibited as behavioral health concerns. My work in helping adults heal from trauma has taught me that even one healthy relationship with a trusted adult can be a mitigating factor for a child's mental health and resilience against substance misuse as a coping mechanism, for example. The same can be said for the delivery of messages of prevention and health promotion. If each one of us listening to this webinar today is a trusted adult in the life of a student, a family member, or a young community member, Dozens, if not hundreds of lives can be positively affected. Children need boundaries, models for kind and inclusive behavior, as well as models for healthy life choices and self-care. According to SAMHSA, one of the most influential factors during a child's adolescence is maintaining a strong, open relationship with a parent. When parents create supportive and nurturing environments, children make better decisions. Though it might not always seem like it, children really do hear their parents' or trusted adults' concerns. If you talk to the kids in your life directly and honestly, they are more likely to respect your rules and advice about alcohol and drug use. And the earlier you start talking to them, the better. Kids honestly don't always have the facts when it comes to alcohol and other drugs. If parents aren't talking about the risks of underage drinking and substance use, their kids might not see any harm in trying alcohol or other substances. Having a conversation allows parents to set clear rules about what they expect from their kids when it comes to substance use. And for young kids, imitation plays a critical role in a child's growth and development. This process, where children watch and copy the actions of others, greatly impacts their behaviors and perspectives. Not only does it help them acquire new knowledge and abilities, but it also plays a vital role in transmitting cultural values and norms. And I really think that's why what we're trying to influence here today. Changing the stigmatizing landscape around mental health, parents, teachers, and trusted adults as role models have a significant impact on shaping positive behaviors and values in children. So, as you've heard, behavioral health is really a community responsibility. It affects how we live, work, learn, and relate to one another. As a community, we must work together to normalize conversations about mental health and ensure that support is accessible and inclusive. By doing so, we set a powerful example for children in our lives, showing them that caring for our minds is as important as caring for our bodies. This is an incredibly worthwhile and important conversation, and I want to thank Commissioner Bai and all of the participants here today for engaging to help us reduce and I hope eventually eliminate the stigma associated with behavioral health care. Thank you for having me here today to support such an important message. Let's lead by example. Let's listen, learn, and support together. Thank you so much and enjoy your day.
Thank you so very much. We are honored to have you and clearly an important teammate with all of us. Thank you so very much, Commissioner Navarrete. And with that, we now are honored to be able to hear from another wonderful teammate, not only to this team here, but to all of Connecticut, and that is Senator Ceci Maher. Senator Maher governs over, or rather oversees District 26. But I say that lightly only because it's important to know that she is invested in all of Connecticut. We are so honored for the leadership role that she plays. She is the Senate Chair for the Children's Committee, and she also is one of the tri-chairs of the Transforming Children's Behavioral Health Planning and Policy Committee. But what is also most important is that she is a human being. She is an advocate. She is a mother. She is someone who recognizes the importance of this topic when it comes to our mental health and that we must prioritize that. In essence, she practices what is preached. And so we are honored to have Senator Ceci Maher as our keynote speaker. Passing it over to you, Senator Maher.
Thank you so much, Lorna. I very much appreciate that kind introduction. Hello, Commissioner Bai, Commissioner Navarrete, Commissioner Hill-Lilly. It is, as always, great to work with all of you. I want to start with something simple but very powerful. Let's take a pause. I'm sure if you are anything like me, you've been probably running around all day, you've been really busy, and now you're here. And how do you settle into this time together? So let's take a really deep breath together. Let's do it now. Now ask yourself, when was the last time you took a breath like that? Just for you. If you had to think about it, you are not alone. As parents and as caregivers, our lives are full. I know. I raised 3 kids. I went to graduate school while I was raising 3 kids, and I've been working as a working mom. So I know what it's like to be running from point A to point B all day long. So our lives are full. They're really overflowing, often with schedules, with responsibilities, with worries, and with love, and with silence. And that silence comes when we don't talk about our feelings and we carry our own emotional burdens while trying to help our children carry theirs. So today we're here to talk about mental health, but more specifically, we're here to talk about the often overlooked yet absolutely critical idea of practicing what we preach. We tell our children it's okay to ask for help. You don't have to be perfect. Take care of yourself. But the question that changes everything is, are we doing that for ourselves? Do we treat ourselves as we treat others that we care about? I'm guessing probably not for the most part because we're so concerned out there. But our children don't just learn by what we say, they learn by what we do. Every single day, they are watching us. They're listening to us. They're absorbing not just our words, but our energy, our habits, and our coping mechanisms. So they notice when we lose patience. They notice when we don't sleep. And they notice when we apologize and when we don't apologize. They especially notice when the advice that we give them doesn't match how we live. That's the first hard truth I wanted to share today. We are the mirror. What we show them is what they learn because we are their world, especially young children. We are very much the world, the entire world for young children. If we teach them to set boundaries but never set any ourselves, they will learn that boundaries are optional. If we tell them to take breaks when they're tired, but they see us running ourselves into the ground, they learn that to rest is a privilege, not a right. And if we encourage them to talk about their emotions, but we never talk about ours, they learn that some feelings are better left unspoken. Our mental health, our own emotional well-being is not separate from our role as caregivers. It is central to our role as caregivers. We live in a culture that, see, I even take a sigh just thinking about it because it's so overwhelming and yet so true. We live in a culture that often glorifies the exhausted parent, the caregiver who never stops giving, the martyr, the supermom, the super dad. But here's what I've learned. Burnout is not a badge of honor. And chronic stress is not a parenting style or a caregiving style. We can't keep modeling the idea that love means losing ourselves, that being a good parent or caregiver means putting everyone else first all the time, every time. Yes, caregiving involves sacrifice, but it does not involve self-destruction. If we don't model self-compassion, balance, vulnerability, how will the next generation learn those things? How will they grow up knowing it's okay to say, I'm not okay? And I heard Commissioner Hill Lilly mention that she has a therapist. I'm a social worker and I have a therapist because I know how important processing and talking about my feelings are. So when I was a younger mom and my kids were little, I didn't process my emotions. And one of the things I remember one day, I really lost my temper. I got super angry at my children. And afterwards, I was thinking, why do I feel better? Why do I feel better because I was so angry? That's very strange. But what I realized, have come to realize over time, is I was releasing emotions that I hadn't been dealing with. And so the anger was not so much directed at my children, it was just an acceptable, not really, but acceptable way for me to express emotions I wasn't dealing with. And I'm so glad I learned that message, because it is incredibly important that we take care of ourselves so that we don't need to yell at our children so that we feel that we've released whatever emotions we're not dealing with. It was a real wake-up call for me. It was clarity, a realization that if I wanted to raise emotionally healthy children, I needed to be emotionally healthy myself. Not always perfect, not always composed. I could still get annoyed with my kids, but not yelling and being present and being honest with them. So modeling mental health isn't about getting it all right. It's about showing our kids that emotional health is a lifelong practice, and we can start it at any time. We can start it today. So this is what the practice looks like. Saying, I'm feeling overwhelmed today, and that's okay that I'm feeling overwhelmed. I acknowledge it. Going to therapy and letting your children know why you're going to therapy. Taking a break. And I want to go back to that for a second, because as a parent, I always felt that I had to present that I was okay and that I shouldn't talk about my own emotions and that it was a burden to my children. But now that I have grown-up children, they say to me, Mom, why are you not talking to me about this? Why are you not including me in your life by sharing your feelings? And I think that that's a really important thing to remember, that by having conversations about mental health, we are also allowing the conversation to become normalized and part of our day-to-day life, and allows them sometimes to not necessarily take care of us, but be more connected to us in the truth of our emotions. So another step that we should take is taking a break. I mentioned this before, not as a luxury, but as a necessity. And a break might mean just sitting down, not folding the laundry while you take a break, but sitting down and just taking a deep breath, maybe closing your eyes, like recenter yourself. Also, another thing to do is apologize when we mess up. Let's face it, we all mess up. And one of the things that I know that I wasn't very good at when I was a young mom was saying I'm sorry to my children. I did learn how to do it, but when I was caring for young kids, I would have a care group every week where the moms would take turns with the little kids, and I wasn't good at apologizing or acknowledging my mistakes. And it's a really freeing thing to say, hey, I'm not perfect. And also, I think it's really important to, when we celebrate rest, we are telling children, and we're modeling for children that everything is not about productivity, that rest is a part of being alive. So when we do these things, we're not just protecting our well-being, we're normalizing what humanity looks like for children. We're teaching them that it is okay to be human in the entirety of us. And I want to say this really clearly. Taking care of your mental health is one of the most responsible things you will do as a caregiver or as a parent. It's not selfish. It's not indulgent. It is essential. Many of us, including me, grew up in homes where mental health was not acknowledged, let alone prioritized. Emotions were swept under the rug and discouraged unless you were angry, as what I learned, or, happy all the time. Therapy was a taboo. My personal experience with therapy is I went to the clinic at the hospital when I was 18 to start talking to a therapist. And when I told my parents, they discouraged me and I dropped out of it. So I think that that's a really wasn't great modeling, but clearly I got past it. And then the last thing is talking about your feelings, we learned was just something you didn't do. When we talked at the dinner table, I grew up in a very big family. When we talked in the dinner table, we talked about everything in the world, but we never discussed feelings. But we together have a chance to break that cycle. We can create homes and caregiving spaces where emotions are welcome guests and not intruders, where asking for help is a sign of strength, and where self-worth isn't tied to achievement, but it isn't tied to achievement or obedience or busyness. Breaking generational patterns is really hard. It requires discomfort on our part. It requires honesty, and it requires community, as I believe Commissioner Bai mentioned before. It's community like the ones we have here together today. And the reward is a legacy of emotional resilience, empathy, and on authenticity, and a feeling of belonging. So, a call to action. What would it be like to practice what we preach? There are 5 small, powerful ways to begin. 1, prioritize your own mental health. Make the appointment to see someone. Take a walk. Write a journal entry. Meditate. Do what fills you up. Secondly, talk openly about your feelings. You can say, I felt anxious today. I was really proud of how I handled that. Let people see emotional language in action. The third, apologize and repair. There's the second step of apologizing. It's called repair, something I learned as an adult in therapy. It is modeling emotional accountability and saying I was wrong and fixing that emotional connection with your children or the people in your life. 4, set realistic expectations. Do not think you have to be perfect, and do not think you need to get this all figured out on day 1. And 5th, practice compassion for yourself. Just as you are probably incredibly kind to your friends and to your family, be incredibly kind to yourself, because you deserve it a whole lot. I was going to say maybe more than anyone else, but okay, I'll let you make that determination. But you deserve to be incredibly kind to yourself, and let your inner voice to yourself be as kind to you as you would be to your child. So our job isn't to raise perfect kids. Our job is to raise whole, healthy, emotionally competent people. And the best way to do that isn't by preaching, it's by walking the path ourselves. So let us not only speak about mental health in our homes, let's live it. Let's mirror it for our children. And let's teach children that self-care is not selfish, that asking for help is courageous, that feelings are not flaws, they are information. Feelings give us information about how we are moving through our lives. And healing is not a one-time event. I wish it were. I mean, I really do wish it were. Make life easier, but it is not. It is a lifelong journey. So we don't need to be perfect to make a difference. We just need to be real. Thank you so much for your time, for your presence, and for the quiet, powerful way you do the work you do every single day, not just in shaping children, but in shaping our future. So let's take one more deep breath together. And let's go out there and practice what we preach. Thank you.
Senator Maher, oh my, still absorbing. I had a little carpal tunnel from taking notes from what you were sharing. Powerful words. You see the reactions that persons have. Oh boy, Thank you so very much for your powerful message, for your notes, the 5 points, reminding us that feelings are not flaws. Oh, there were so many wonderful words that you had to say. Bless you. Thank you so very much. And thank you for your leadership, helping to support and raise all of these children in Connecticut and support the families. Thank you.
Thank you,
Thank
Lorna.
you.
Take care. Bye, everyone.
Oh, right. Wonderful. Oh, my. Still absorbing. Well, as we continue on, we are now going to also receive some additional words and influence of the importance of mental health. And before doing so, would like to pass it over to introduce the video to a wonderful teammate, Karen Pascal, who is the Connecticut Head Start Collaboration Office Director at the Office of Early Childhood. Karen, passing it over to you.
Thank you so much, Lorna. Hi, all. So happy to be with you today. Mental health awareness is so important for all of us. As Lorna shared, my name is Karen Pascal, and I serve as Connecticut's Head Start Collaboration Office Director. Part of my role is to help connect our federal Head Start programs to state systems and services to help them best meet the needs of the children and families they serve. Head Start has a long commitment of ensuring that programs meet the health and mental health needs of the children and families enrolled, as well as the staff members they employ. In fact, recent revisions to the Head Start program performance standards, those are the regulations that govern Head Start programs, called for better integration of mental health across all aspects of Head Start programming. We recognize that the mental health of children and the adults that care for them are essential for school readiness. So today's video vignette will provide a brief overview of what mental health is and why it is so important for us to talk about it. Thank you.
Did you know that your mental health is just as important as your physical health? Mental health describes how it feels to be you. When we are mentally healthy, we often feel at peace and able to live a good life. While it may sometimes seem like people around us have a perfect life all of the time, it's best not to judge only on appearances. People are neurodiverse. That means we all have different brains. And we all have different ways of expressing how we feel on the inside. And it's not a bad thing to have trouble with your mental health. Everyone does at times. Like feeling very worried, having trouble sleeping, or feeling sad for a period of time. Just like how we all may catch colds every now and then, no one is mentally healthy all of the time. Mental health conditions are often invisible. That means we can't see them with our eyes. And that means that others can't tell if you are struggling with your mental health just by looking at you. So guess what? We have to talk about mental health. And while your dog is a good start, you should really talk to actual people, too. So pay attention to your own mental health, and to your friends and family. And don't forget to reach out to others about your own mental health.
Thanks for watching. Until next time.
Thank you. So again, more reminders of how important our mental health is. And with that, have the honor now of passing it over to two wonderful teammates who are part of two wonderful agencies that help the state overall promote and support mental health. It is my honor to introduce Lakeisha Hyatt, who is the Chief Executive Officer of the Connecticut Valley Hospital, which is a part of DMAS, Department of Mental Health and Addiction Services. And following Lakeisha, we'll hear from Dr. Nicole Taylor, who is the Chief Administrator for the Office of Behavioral Health and Well-Being with the Department of Children and Families. But first, in honor to pass it over to Lakeisha Hyatt. Thank you so much for being with us, Lakeisha.
Thank you, Lorna, and good afternoon. Oh my goodness, what a treat we have truly experienced with Senator Maher. First, let me greet again the three commissioners that are on: Commissioner Bai, Commissioner Hill Lilly, Commissioner Navarrete. Thank you so much for this opportunity, and honoring also Karen and Lorna yourself for the great work that you are doing in coordinating all of this. Oh my goodness, what a treat. Seriously, here we are little eyes watching and learning. And the question that is posed is, how does DMIS, the Department of Mental Health and Addiction Services, how does DMIS support mental health? And really share all of DMIS in about 5 minutes. And when I think about the multitude of the work that this organization does with serving averaging 95,000 individuals per year. And most of those individuals served through collaborative processes, community-based, DMIS-funded, private nonprofit providers, 90%. We also have the 8 state-operated facilities, which I am one of those. I represent one of those 8. They serve about 10% of the population. But this question that's posed to us now is, how does DMIS support mental health? And when we think about, I really thought about these little eyes that are watching us. And they're watching to see if we practice, if we preach what we preach. And I began to think about these small children, and they're looking at the individuals who I consider the village. If you think about the African proverb that indeed it takes a village to raise a child, there's a village that these little people with those cute little eyes, and I'm imagining some Afro puffs as well, they're looking at members of this village. And the question really is, how does DMIS support the village of the little people who are watching? And that's what I'll share with you very briefly. We design services to serve the village that may not have all of the resources. As Commissioner Navarrete said, we build recovery around strengths. It's a rich system, not necessarily in dollars, but in the depth and the intentionality of the design. So what I'll share with you very briefly in the remaining time is I'll share with you a couple of dimensions or ways in which the systems are structured and give you some examples. The first thing is, it's an integrated care model designed with intentionality and interwoven system where mental health, addiction, physical health services are collectively addressing the needs of the entire individual. Why? If you think about SAMHSA's published data of 20 million people with substance use disorders, more than 39% also have mental health diagnoses, members of the village. Over 50% of people with schizophrenia, bipolar disorder, and other severe mental conditions have a substance use. So we have to design a system where care is designed with the knowing that co-occurring mental health, substance use, trauma, they're an expectation, not an exception, in both mental health and addiction treatment settings. Also, a system has to have no wrong door. And each disorder, each diagnosis has to be treated as primary. No primary, no secondary, but it's all one, and we're intentionally engaging and treating them collectively. Examples: seeking safety, an evidence-based curriculum-guided treatment for trauma and addiction, behavioral health home, quality treatment model for individuals with co-occurring physical, substance, and mental health conditions. The second construct, continuum of care. The service framework designed with a continuum ranging from prevention to early intervention to acute inpatient care, and then the intentional development of long-term recovery sustaining supports. Examples of that: opioid prevention, suicide prevention, 988 Suicide and Crisis Lifeline, the Action Line, tobacco prevention, maternal health promotion, emergency department recovery coaches, statewide substance abuse access line and transportation, and then at the other end of that continuum, having 2 Joint Commission accredited hospitals, with one being a forensic specialty and the other one specializing in general psychiatry and addiction medicine. Real-time bed availability. Remember, the little eyes are watching the village. And so for these individuals that we wish to serve, these adults, 18 and above, the system is designed focused on community-based services. DMIS design services that meet people literally where they are in the community, ensuring services are accessible, culturally responsive, with intentional celebration of diverse populations. Those warm lines. As was said, someone to talk to who understands. The warm lines, telephone support services staffed by individuals who have experienced expertise with mutual support. How about the Women's Reach program, recovery, engagement, access, coaching, and healing? The Women's Reach program provides statewide integration of women's recovery navigators, intentionally non-clinical program that offers recovery peer support and case management services to pregnant and parenting women of the village that these little eyes are watching. There are 10 assertive community treatment teams across the state, a multidisciplinary team to provide comprehensive, highly responsive, individualized recovery-based rehabilitation services, and then PROUD, parents recovering from opioid use disorders. Now, this program for the village members who are pregnant, postpartum women with substance use disorders. Little eyes are watching how we support this village. And so it's imperative that the Department of Mental Health and Addiction Services has person-centered, trauma-sensitive approach, a purposeful, evidence-based pace to respect and embrace individual preferences, strengths, and cultural backgrounds. Trauma-informed care is literally embedded throughout to promote safety, trust, and empowerment for all service users. Examples: the Connecticut Veterans Justice Outreach Program, the Demas Jail Diversion Teams, adding recovery coaches to those teams, CORP, the Connecticut Offender Reentry Program, and then the opportunity that was taken to educate attorneys and on the specifics of trauma, peer support and advocacy, the Gloria House, Connecticut's first peer respite program, YAS statewide RSS peer support, and then the relaunch of our Champions for Diversity, Health and Equity, building cultural awareness and capacity. Amazing work, individually focused on the strengths of individuals. Then collaboration, model today. This is the fifth structure of the system, collaboration and partnerships. 90% of the services, as was stated, provided by private nonprofits. Collaboration. Demas works closely with our state agencies, as we see today, DCF, OEC, DDS. Build community through collaboration. The little eyes are watching. For this village and how we take care of this village. What do we hear from the village? The system that we are serving in, Department of Mental Health and Addiction Services, pays attention to quality indicators, being an evidence-based practice service-driven system, being a data-driven service delivery system. 93.6% of the individuals receiving services said that staff believe that they can grow, change, and recover. 93% said, I like the services. 92.9% felt comfortable asking questions. 92.7% felt the staff respected wishes. This is a system that is intricately interested in the response and the perceptions and opinions of the individuals that we serve. Focus on recovery and wellness, again, for the village that is serving the little eyes that are watching. Recovery-oriented services emphasizes resilience, self-determination, community integration, supporting individuals in achieving meaningful life goals. Over 25 rehab club centers, learning and wellness centers, supported employment providers. So these are examples in the time that now has been expended. These are examples of the ways in which Demas supports mental health for the village of the little people who are watching. We design services to serve the village, these adults 18 and over. Now, I said a lot, and I only listed a portion of the services. And with intentionality, there's no PowerPoint. I invite you to go to our website to please, everything that I shared is there. And I hope that you heard the thread woven through today. The thread is services are crafted for the village with intentionality to ensure that we identify the strengths of the individuals in that village so that we can support the children that are watching. And so again, Demas website, ct.gov/Demas, invite you to go to that website, ct.gov/Demas. Everything that I shared and more can be found there. Thank you for this opportunity.
Oh my, thank you so very much, Lakeisha. Boy, the wealth of information you shared, and to know it's only a fragment of that. Thank you so very much. And you have made a helpful transition over to Dr. Taylor, who's going to share more about DCF and how they support mental health. Passing it over to you, Dr. Taylor.
Thank you, Lorna. Good afternoon, everyone. I just want to echo really an amazing presentation so far from the three commissioners, Commissioner Navarrete, Commissioner Bai, Commissioner Hill-Lilly, and also from Senator Maher. And I'm going to continue the trend of just the importance of mental health. As we think about our physical health in children, we're very focused, or we're very good at ensuring that our child receive their well visits, their immunizations. If they have a scratch, we take them to the doctor. Well, mental health is equally important. And at DCF, we try to support the mental health services for children in Connecticut by numerous programs and initiatives that we have created. But more importantly, as we think about little eyes that are watching, we have to think about what is important to us and what they see and model those. So one of the things that we've modeled is our partnership. The work that we do is in partnership with DEMAS, is in partnership with OEC, in partnership with DSS, as well as DDS. So, you know, as well as our community partners. A lot of our service is actually delivered not from DCF directly, but through our partnership with local providers so that our families can be served in the communities that they're most comfortable with. The other important behavior to model is recognizing when you need help, when you need to lean on someone, and being able to find that. So while parenting, there are many books about parenting, many books about raising children, but when you give birth, you don't get a book. And so having partnership, knowing where you can lean on, and that's one of the focus that DCF does. I do want to talk about three of our programs that are assist families with younger children. So in the first few years of life, our family-based recovery initiative is a in-home program that is offered to parents with children 0 to 5 years old. And this helps with building resilience, as Commissioner Navarrete mentioned before. So for families or children who are at risk for abuse or neglect, poor development outcomes, or removal due to substance use. There's also our parent-child interaction therapy, which is an initiative to treat children between ages 2 and 7. And then our Child First initiative, which is also in collaboration with OEC. And this is an intensive in-home therapy to address learning problems or emotional, behavioral, developmental challenges in young children. And this is also from 0 to 5 years old. We do have an array of other behavioral health initiatives that DCF support, either through contracts or through other partnership. And this range from outpatient clinic to our inpatient psychiatric hospital. There's also a relatively new service, our urgent crisis center. There are three throughout the state. And this is a place where any parent can walk in as you would an urgent medical center. And really ensuring that the the priorities that we give to mental health is equal to physical health. We have mirrored a lot of the services that you can get for physical health. So when your child has fallen and is weak and you're not, the doctor's office isn't open, you can take them to an urgent care center. Well, the urgent crisis center is similar. When you're having a challenge with your child during an emotional episode, you can take them to one of the three urgent crisis center. Again, as we think about little eyes watching and what do we do in our behavior, not just as parents, but as a system and modeling the behaviors that little eyes will see and hopefully follow. We do emphasize partnership and then having those services for when you need help. And as as Senator Maher has mentioned, needing help is not a sign of weakness. Needing help is a sign of strength. And what DCF is committed to doing is working with the village, working with our partners to being available when help is needed. Again, thank you for having me.
Thank you so much, Dr. Taylor, for being with us. Again, it is an honor to have you with us. It is an honor to have you be a part of the village and helping to support and educate our children and families, and appreciate so much the commonality of the language you spoke, as well as Ms. Hyatt in terms of intentionality and collaboration and systems. So thank you so very much. And with that purpose, we want to continue the conversation. We want to continue the dialogue as it pertains to it takes a village. As it pertains to it's a matter of working together. And so honored at this time to introduce our wonderful panelists for our panel discussion. And as I mention your name, I'm going to just ask for you to say hello, just so the camera can feature you for a moment, so we can associate a name with a face. And first on as part of our panel discussion, we are honored to have Dr. Fatmata Williams, who is Deputy Director of Medicaid and Division of Health Services at DSS. Fatmata, may you please say hello?
Good afternoon, everyone.
Thank you so much, Dr. Williams, for being with us. And next we have Dr. Liliana Keat-Blanks, who is a psychologist at DDS. May you please say hello?
Good afternoon, everyone.
Wonderful. Thank you so much. And then we have Kate Bohannon, and I apologize if I did not say your name correctly. That's why you're going to say your name as well. And she is Associate Education Consultant, for School Mental Health, Safety and Crisis Response, and a Social Work, and Title IV Part A. Ooh, lots that she does, all with SDE. May you please say hello, Kate?
Hi, good afternoon, everyone. And you got the last name. It's Bohannon.
All right. Well, thank you so much, and thank you for joining us. And last but certainly not least, we are so honored to have Dr. Nicole Cassette, who is Birth to Three Part C coordinator at OEC. May you please say hello?
Good afternoon, everyone.
Wonderful. So glad to have you here, and so glad to have the rest of the team here as well. So let us continue on with the wonderful information sharing with authenticity. I really appreciate the realness that has been described and disclosed so far. But let's first learn a little bit more about each of you. The first question is, can you please tell us a little about yourself? As in, what agency do you work with, and what is your role there? And since I see your lovely face, Dr. Cassette, I'm going to start with you, please.
Thank you, Lorna. I am Nicole Cassette, and my background is in infant and early childhood development, and I work at the Office of Early Childhood, and I oversee the Birth to Three system in Connecticut.
Thank you, Nicole. So glad to have you. And Kate, may you please share?
Hello again. So as I said, I'm a consultant for the State Department of Education. Lorna kindly read off all the different things that might fall under that big umbrella term. But I really enjoy that my role does have that big umbrella term, because mental health isn't just one thing. It incorporates so many different aspects, and it's part of everything. So prior to joining the State Department of Ed last June, I spent the last decade working as a school social worker in both public and clinical day schools.
Thank you for being with us and for all that you oversee under your umbrella. Thank you. Thank you. Dr. Williams.
Thank you. So I am Fatmata Williams. I have been a registered nurse, now a psych advanced practice registered nurse for the past 28 years. I currently serve as the Deputy Medicaid Director for Connecticut, where I oversee the administration of the Medicaid and the Children's Health Insurance Program for about 1 million Connecticut residents. Thank you.
Oh my, you say that number so large, and so honored to have you with us as well. Thank you so much. And Dr. Key Blanks, over to you, please.
Hello again. I'm Liliana Keat-Blanks. I'm a psychologist with the Department of Developmental Services. And since we haven't talked about this agency, I'm going to take a second to describe a little bit talk about the agency. The Department of Developmental Services works mostly with people with intellectual disabilities and or Prader-Willi syndrome. when they are adults for the most part. We do have a child division department that works with children with complex and intense situations that intersect at different points, including DCF, DMAS, and DDS involvement. My role within DDS, I'm the only bilingual Spanish psychologist throughout the state of Connecticut. We consult, psychologists at DDS typically consults with different agencies, community companion homes, and family homes regarding clarification of diagnosis, connection to community providers, and advocacy. We also work closely with the Department of Justice, providing competency evaluations and restorations for people who are deemed not competent. In regards of connections with children, we work with DCF, and we also have an eligibility department that works with making sure that the individuals that are going to eventually get our services have all the documentation necessary for that process. And that usually includes some sort of communication with schools and community providers. Thank you.
Thank you. And a lot that you certainly are doing as well. And thank you so much for doing so with a lens of equity in terms of ensuring that persons that are multilingual learners are able to participate. So thank you. Thank you. And going on to the next question, because some of you have touched on what you do and certainly want to hear more of what you do and what your agency does. The next question is based on the agency where you work, how is mental health recognized and or supported? What programs are in place to promote mental health and wellness? And I will, at this point moving forward, leave it up to whomever would like to go next.
Okay, I'll go. So first of all, thanks, Lorna, for having us. And I really want to echo what the commissioners, Commissioner Bai, Commissioner Healy, Commissioner Navarrete, and the Senator. I thought we would end the discussion after Senator Maher's talk because I just thought it hit all the points and all the people who have preceded us, Karen, Lakeisha, Dr. Taylor. I think they have touched everything that I really would have to say. But one thing I wanted to highlight is the idea around partnership, because at the Department of Social Services, while we cover a comprehensive array of behavioral health services across the continuum and across the lifespan, we do so in partnership with the Department of Children and Families, the Department of Mental Health and Addiction Services, to ensure that we capture those folks who are eligible for services under Medicaid. And one program that I really want to highlight is our 1115 substance use disorder waiver that we implemented in 2022, where we're able to cover services, mental health services, that we otherwise would not have been able to cover because of where they were delivered, looking at residential mental health services. And as a part of that program, we are also covering mental health and substance use disorder services for pregnant and parenting women, and that was highlighted by quite a few people on this call. In addition to that, there is a partnership between the Department of Social Services, DMAS, and DCF to administer behavioral health services across the board. And I also wanted to talk about some pilots that we're doing to serve the little ones, the little lives that are watching, the 0 to 5 population. DSS has partnered with Connecticut AIM, which is for infant mental health. It's a group where we are piloting, looking at the 0 to 5 population, having family resource centers in pediatric practices, beginning to look at the diagnostic criteria for 0 to 5 to ensure that we are also addressing the mental health needs of that population. But I don't just want to say what we're doing externally. I want to highlight what we do internally, as to the adage of physician heal thyself or practicing what you preach. Internally at DSS, we do have holding spaces that's done by our Office of Diversity, Equity, and Inclusion, where employees can come and talk about what's going on in the day. We started that during the George Floyd murders, and we are potentially going to start that with for what's going on. So employees can just come to a safe space and talk about their mental health and what's going on. And we're constantly elevating the employee assistance program, so employees are aware that this is available and this is also something that they can use. So I'll stop there and just allow my other panelists to continue. Thank you.
I can jump in because you highlighted CT AIM, which is something that the Office of Early Childhood also partners with to really infuse mental health throughout all of our programs. And I think mental health and wellness is really infused throughout the department. Each division is going to focus on improving the mental health of children and their families, and really supporting parents and their caregivers. So, in addition to supporting and partnering with CT Infant Mental Health, we support families through early intervention, our Connecticut's Birth to Three system, home visiting, as Commissioner Bai had referenced, early childhood consultation partnership, Help Me Grow, and we also have a behavioral health initiative that Lorna does a wonderful job really orchestrating and supporting. And that really brings programs and services to support the psychological, emotional well-being of children in early childhood and really aims to strengthen the support. So I think really looking at this, it's what OEC does and what we embody, and really how do we support. And there's not one conversation that is a systems level conversation that we have that we're engaged with that does not include how do we ensure that children get what they need, their caregivers get what they need. And also with that, we have a parent cabinet that really infuses information from the OEC out to the field. So there's multiple venues in which we're supporting the initiative. And I think it echoes a lot of what's going on in our sister agencies, but a lot is really focused on that mental health and awareness for children, but also for their caregivers, because we know that supporting young children isn't just supporting the child, it's supporting whoever is in that household with the child as well.
I can go next. Can you all hear me? Yes. Okay.
Yes.
So, sorry. So, the question is based on the agency where you work, how is mental health recognized and supported, and what programs are in place? At DDS, we have been striving to make more services available for our population. The people that we serve, people with intellectual disabilities, tend to get discriminated a lot, particularly in regarding of mental health with diagnostic overshadowing. If your kid or a person in your life has an intellectual disability or any other learning disabilities or cognitive issues, they are still at risk for having mental health issues. Having a cognitive disability doesn't mean that your kid cannot also have mental health issues or something that they need to work on. So for us, it's very important to make sure that people understand that not because you have one diagnosis means you're gonna be, you're not gonna have anything else, right? We usually have multiple things going on, and it's not only diagnosis, as other speakers have talked about, it's also social issues that we might have: poverty, access to services, access to services in your language, things of that nature. We work really hard to try to undo some of these thought processes in the mental health community. So a big piece of our work is advocacy for right psychiatric services and right medication regimens. We promote mental health and wellness at DDS in different ways. Regarding policies, we have been moving from people being in institutions to people being integrated into the community as best as possible. We also like to promote wellness by making sure that people are busy and they have something to do. Senator was talking about the importance of rest, and that is really, really important. We need to move from this thought that we need to be at a point of exhaustion before we take any rest for ourselves, right? We've gotten to a point where we think we need to deserve rest, and we need to move away from that. Access to structure within the community for some of our individuals is actually helpful, right? We can always have too much of something. And for some of our individuals, structure is really beneficial. We also work with a program review committee that goes over medications and behavioral support programs for our individual and make sure they're not too restrictive or that people are not over medicated. So that's another way that we are trying to work promoting mental health and the right types of treatments. We also have a human rights person in that committee that makes sure that we're not restricting people to a point where it doesn't make sense. We also here in the North region have been providing services through groups tailored to our individuals' needs. And I think that's important at any point, in our lifespan, is to have the right services that work for us. That means finding cultural competent people that understand what we're doing and also making sure that we adjust our practices to include everybody. Thank you.
I can jump in. So when I was trying to sort of summarize this question, as many people said, there's a lot. The State Department of Education, we support students from 5 years old all the way up through their transition at 22. So there's a lot that we do, and I kind of categorized it in a few different areas to summarize the best I can. One thing that State Department of Ed does is we oversee a lot of grants, and we award grants to schools to help strengthen their own mental health supports and services. One of the major ones going on right now is through the American Rescue Plan, the ARPA funds, and we've used a portion of those funds to invest in school mental health supports. And since 2023, we have awarded over $26 million to school districts and summer camp programs to hire mental health professionals like social workers, psychologists, and counselors, and also to provide professional development opportunities. Another thing that we do at the State Department of Education, so we provide guidance and curriculum. So State Department of Education releases guidance, frameworks, and model curriculum on a variety of topics. Some of these documents, it's kind of obvious that youth mental health would be part of it, such as the K-12 social, emotional, and intellectual habits. But others, like the recently released K-12 digital citizenship curriculum, also address youth mental health, but that might not be so obvious based on the title. One document that I'm particularly proud of is the position statement and policy guidance on personal technology use in Connecticut schools that was adopted by the State Board of Ed in August of 2024. So I worked on research and writing the draft of this document and really made sure that it was grounded in the impact of excessive social media and technology use on adolescent brain development, mental health, and academic performance. So another area or way in which the State Department of Education supports youth mental health is providing professional development in connection to supports and resources for our school districts. We are able to provide personalized guidance. We also, as I said, host different professional development opportunities. For example, earlier this year, I hosted a webinar and we had over 250 participants from schools across the state. It was on youth suicide prevention, intervention, and postvention for schools. And that was really focused on best practices in those three areas and also connecting schools to community resources. That's another thing that is a heavy focus of mine in particular. As I said, I joined the State Department of Education last June, and I feel like a broken record over this past year because you don't know what you don't know. There are so many supports and services and resources out there for educators, for students, for families. But unless you know that they're there, you can't tap into those. So that's something that I've really been trying to promote through the course of this year. Another thing that I am part of is the Connecting Schools to Care initiative, which is partnered with DCF, CHDI, the Children's Health and Development Institute, Favor and Carelon. So that's really, again, about increasing the school's awareness of available mental health supports in the community to connect families and students to care. The State Department of Education, we also hosted virtual house call this fall, this series. I can put the link in the chat. It was about supporting your child's health and well-being during the school year. So one of those is focused on suicide prevention. Another one is on the cold and flu season. And the third is a discussion with Dr. Ketter, who is a behavioral pediatrician. So that was really great information there. And as we're talking about, what does your agency do to support sort of mental health and wellness for your employees? It's interesting because at the State Department of Education, right, like we have our employees who our State Department of Education employees, but we also oversee all of the educators and teachers and paraprofessionals and support staff in schools. So that's something that's on our mind as well. We all hear about educator burnout. So what are we doing to advocate for the needs of our educators and also support them through their own professional and personal journeys and the difficulties and the realities of working in the education system right now. So that's just sort of a quick overview about the State Department of Education and our efforts to support and promote youth mental health.
Thank you so much. And your response dovetailed quite well with incorporating the responses of your teammates. But thinking about Dr. Williams, how you were talking about efforts internally to support employees in terms of their mental health. And Kate, with you talking about the importance of supporting the educators because burnout certainly is real. And so thank each and every one of you for your responses and sharing what you do within your respective agencies. But what is so clear that what you do, you cannot do alone. All that you described showed the interconnection between the sister agencies and how we must work collaboratively when it comes to supporting children and families in Connecticut. Operating through silos does not work, and you have shown how it's important to work together. So thank you so very much for that. And with that, I want to continue in that vein with the next question. Children are constantly watching and learning from adults in their physical environment or virtual world. I'm going to say that once again. Children are constantly watching and learning from adults in their physical environment or virtual world. The reality of what children see on social media, the television, those pieces, it's real. So they're exposed to that. So recognizing the influence that state agencies have in the community at large, that each of you in your respective agencies have, do you think destigmatization of mental health is important? And if so, why? And then a subpart to that question, what are ways to think, what are ways you think are helpful to promote mental health and wellness? So a two-part question. The first one is recognizing the influence state agencies have on the community at large. Do you think destigmatization of mental health is important? And if so, why? And what are ways to think are helpful? What are helpful ways to promote mental health and wellness? And so we'll start with Nicole, please. And I hope you all don't mind if I may call you by your first name for the remainder of our time together. I feel like we've had our bonding moment. So thank you. So thumbs all right. Thank you. Thank you. Nicole, to you, please, for this question.
Thank you, Lorna. Happy to jump in. So I think absolutely without a doubt, I think we need to support and destigmatize. It could lead to accessing supports and earlier detection and support for children and their families, which would then lead to a healthier community if we really destigmatize and really support everyone throughout the community. I think mental health is equally as important to physical health. And in fact, when looking at research, we know that cortisol, which is that hormone that's released when there's a stress response, plays a vital role in our immune response and a lot of other health factors that go along with that. When we think about stress, I often think about toxic stress and the impacts on health. And when occurring under prolonged periods, it really does impact folks. It could impact and create heart disease and other health factors there as well. I think when we think about mental health overall, if we support it, it really does break down those barriers for people and would promote a healthier family unit, but also that community. And I also think it would equate to that healthier community in terms of health factors as well. to promote the mental health and wellness, I think it really does go back to that community and creating environments in which support is being provided and folks are feeling balanced and resilient. I think it's promoting that resiliency factor as well and understanding that things sometimes happen, but how do we ensure that folks have what they need to overcome? I think with a community approach, we get into that dyadic approach. And I referenced earlier, when we think about the child, we can't think about the child without the parents or caregivers in that child's life. And it then goes to the individual themselves, which often makes me think about Bronfenbrenner and his ecological systems theory. I think healthy habits, being infused within the community, such as sleep, exercise, access to nutritious foods and other areas of health and wellness, we would then open that fostering of the promotion of mental health and wellness. I think if we want to foster that, also including that open communication and normalizing emotions, right? Not thinking that one emotion is bad, but how do we ensure that we're supporting children and working through those emotions, work in recognizing emotion and, really dealing with those emotions as they come. And that would then lead to a safer and more inclusive community, and really allowing that channeling of that support.
Thank you, Nicole. Thank you. Fatmata, what are your thoughts?
Thank you, Lorna. I think Nicole touched quite a bit of what I was going to say, but what I would say in terms of the stigmatization around mental health, I will add another aspect to it. Not only do we need to destigmatize it, we need to create parity between mental health and physical health in how we cover it in terms of coverage, and then in how we treat people who present with mental health and physical health, understanding that people present as a whole, they don't present in parts. So regardless of where you are and who you are, where you're situated, when someone presents, you treat them as a whole person, because it will encourage people to seek care, mental health care more often. People who are vulnerable will have access and they will get treated. And again, to Nicole's point, it will build that resilient community looking at trauma-informed care and holistic care. In terms of ways that we can go about it, Nicole did talk about normalization. I would also include integration in terms of, again, moving towards when people show up. You could be a cardiologist, but someone shows up to your office, they're looking disheveled, tired. It could very well be contributing to the cardiac condition, but it is not okay to just worry about the cardiac issue. It is okay to say, are you feeling depressed? Or there's something going on here. Even better, if you have a behavioral health provider that's co-located right there, that you can refer or make that direct connection so that person will get the treatment. So I think just looking at our overall systems of care, normalizing these conversations, looking at BH integration. I'll give a quick story that when I went for my psychiatric APRN, there were a whole lot of other students in the class, and one of the students said to me, she's East African student. What are you doing in psych? What are you doing in psych? Again, because of that cultural framework where we're not comfortable. We're talking about mental illness. It's a taboo, and I think Senator Maher did touch upon that. We have to make it okay to talk about mental illness integrated into our health systems, and I'm moving mental health, physical health, spiritual health. We are very complex beings, but we keep looking at us in parts. So I'm just, BH integration is another way that we can go about this. Thank you.
Absolutely. Thank you. Oh my. And as you were preaching to us, Kate, may you please continue to preach to us?
Well, it's so interesting because one of the things that I bolded is that mental health shouldn't be treated as its own thing, right? It's not like we're going to do mental health now. It really needs to be part of every day, because it impacts people, families, communities, systems. Um, and I have an interesting perspective, working with, most of my experience was with not the little guys, but the little students, but middle school and high school. So I can tell you all that this is working, right? Over the past decade, I noticed a shift in the way that our older students are discussing mental health, their acknowledgement when they are struggling, and there's not the same level of, like, sadly, shame or embarrassment that I think used to be more prevalent. And that is a testament to this destigmatization and the work that is being done in families and communities and providers to have these courageous conversations. And it's moving and powerful when I was able to witness these youth sort of help their parents or their families or their older generations in their life understand that it's okay not to be okay. And and really just working on that system as a whole. And school is an interesting piece for many families, as I'm sure everyone on this call knows, because parents or caregivers walk into the school with their own identities, but also their own history about what it feels like to be in a school. And that wasn't positive for everyone. So that's really something that I know at the State Department of Education that we encourage all of our educators to keep in mind that you're looking for that person-to-person connection, right? At the end of the day, we're all sitting around a table, we're on the same team, and we're all just people here with the best of intentions and with your child's best interest in mind. And in order to really be equal partners on that team, you have to acknowledge what everyone is bringing in to the table. And I've just seen that can bring about some really powerful pieces for families, but also for educators. So it's working, and I think we've come a long way. I think we have a long way to go, and um, you know it's these individual conversations are so important because that's what will drive the systemic change, and the policies and procedures in place. It's these sort of grassroots conversations about the communities coming together and saying, we need to acknowledge this, we need to support this, we need to support each other. So I'm really excited to see what's to come in the future, continue to have these important conversations, and to collaborate more with some of my colleagues at our different departments. So thank you again for having me. I'm really enjoying this discussion.
Absolutely. We're enjoying the discussion, having you a part of the discussion with all that you shared and talking about at the table and the voices we certainly want to include and hear. Liliana, your thoughts in terms of in response to this question.
Okay, so most everybody have talked about ways to promote mental health and wellness. For the first part of the question, talking about recognizing the influence that we have as state agencies in mental health and the destigmatization. I think it's really, really important that we as state agencies really work with this because we have an influence, both positive and negative, in this process. The impact that we have is that we, as a state agency, work with policies and funding, who and why we pay them for, and what they can do, state-specific regulations such as licensing of professionals and service delivery in person, telehealth. We also, as state agencies, are working with the integrating behavioral health, as Fatma was talking about. How important it is to see mental health as just any other part of your health and not thinking that it's something that we could just always put off. Because as she was talking about and other people were talking about, when we are stressed, we produce things in our body, we do things to our body that can affect them long term and can even contribute to those cardiac issues, diabetes, all these other conditions that we are trying to prevent, right? On the flip side, sometimes the culture can be different from office to office within state agencies, even within the same agency. Some people are more believing in community health, integrating things, and other people are more focused on different ways of treating these issues. So sometimes we can be better by bettering our policies, processes, and speaking up when we know and see that people are doing something that can cause further stigmatization of people with mental health illnesses. In regards of promoting mental health and wellness, I would like to focus on the importance. Like I think as agencies, we should be focusing on promoting the importance of community beyond working relationships or family. I think there's like a lot of loneliness, a lot of not knowing who to talk to. So promoting social spaces, gardens, concerts, events where people can connect and just be a person. Just as I want to go back to Senator, you don't have to earn these things, right? Just be a person. You don't have to be a statistic or a number. I'm a student or a worker, right? We can just be ourselves. So one thing that I think within schools we could do is promoting curriculums that include self-regulation skills, emotional awareness, and coping skills. And for the parents, I would say very simply put, to promote mental health and wellness, be humble, listen to your kids, apologize when you're wrong, right? Show it's okay to be emotional. Why, if we have a member of our family that's going through something, it could be anything, it could be sickness, it could be incarceration, it could be death. Why are we hiding from our kids and our family when we have to cry about it or when we have to think about these things and reckon with what happened, right? We can show our kids that we are emotional and we are not damaging them for that, right? We have to find the right ways to talk about to our kids, but it's important to be there and be honest.
Oh my. It's important to be there and to be honest. Thank you, Liliana. Oh boy, thank you all for your responses to that question. And I recognize the hour. I'm going to squeeze one more question in, but I'm going to modify it, teammates. And thank you already for your flexibility with this. If you were sitting in an auditorium filled with young children, what is one word of advice you would give them about the importance of them recognizing and speaking about their feelings? Again, if you were in an auditorium, let's say a stadium, you were in a stadium filled with young children, and you were to give them one word of advice about the importance of being aware of their feelings and talking about their feelings, what would that be? And I know this is a modified question, but you all have been so genuine and so authentic in participating in this panel discussion. I thank you so much for sharing your perspectives from your state agencies, but doing so with authenticity. And so we're just going to go a little deep with this last question, deeper with this last question. And Liliana, since I see your lovely face at this time, may we begin with you, please?
Yes. I think the word I would use would be notice. Notice your feelings so you can talk about them.
Thank you, Liliana. Notice, and as we notice, Kate, what would you say?
I'd see. I would say feel your feelings, even if you don't know exactly what they are. And that feelings can be messy and they can be overwhelming, but they're never wrong. So whatever you're feeling is okay. Um, Hopefully, at least some of the kids in the auditorium or the stadium would listen to.
Absolutely. Feel your feelings. Yes, thank you. And as you are feeling your feelings, Fatmata, what may you say?
I would say your feelings matter, and you can talk to a trusted grown-up about them.
Your feelings matter, and you can talk to a trusted grown-up about them. Absolutely. And recognizing that your feelings matter, Nicole, please close this out. What word would you say?
I would say acknowledgement. Acknowledge your feelings, acknowledge what you need to address those feelings, and what are the resources that you need. Acknowledge everything so that you're taken care of.
Absolutely. Acknowledgement. Yes, yes, yes. Boy, I am just so honored and humbled to be in the company of all of you, Fatmata, Kate, Liliana, Nicole. Thank you so very much for your words of wisdom that you have shared during this panel discussion. We have learned from you about your agencies, but also learned about how your agencies are practicing what we are striving to preach. Thank you so very much. And with that, want to continue and expand the thanks and appreciation. Certainly want to thank Diana Reyes for giving instructions on how to access interpretation. And certainly thank you to Aranda and Louisa for providing interpretive services to us today. And they are from NWY. Thank you, thank you. Cannot move on without thanking our wonderful commissioners. Commissioner Beth Bai from the Office of Early Childhood. Thank you so much. Commissioner Jody Hill Lilly from the Department of Children and Families, and Commissioner Nancy Navarrete from the Department of Mental Health and Addiction Services. Thank you collectively for recognizing the importance of us being mindful of our mental health and practicing what we preach. Thank you for your warm, welcoming remarks. And certainly, Senator Ceci Maher. My, oh my. You've noticed that your message continued on throughout the webinar, and that just highlights how powerful your words were. There was one piece that much of what you said was so powerful, but I want to recognize again your point of our job is not to raise perfect children. Our job is to raise whole, healthy, emotionally complete people. That is from Senator Maher. Thank you so much for your wonderful, powerful message. Certainly, Karen Pascal, thank you so very much for introducing our video talking about what is mental health. And we credit that video to Transitions Abilities. Thank you, Karen, for your wonderful teamwork and sportswomanship, that is. And Lakeisha Hyatt, Dr. Nicole Taylor, thank you so very much for sharing what your respective agencies do. That pertaining to DEMIS and DCF, it's important to know how you support mental health throughout the state of Connecticut and beyond. And again, to our wonderful panelists, Dr. Famata Williams, Dr. Liliana Keith-Planks, Kate Bohannon, and Dr. Nicole Cassette. Thank you so much for your powerful and inspiring words. And also want to recognize our team behind the scene. Jen Ide, thank you for managing all things Zoom related. Thank you, thank you, thank you. Team O'Donnell, thank you so much for recording this webinar and helping us to have it posted on our website. And thank you to UConn School of Social Work Innovations Institute for helping to collect the data from this webinar. And data, what am I talking about? Survey. Please all be mindful. You will receive a link to a survey, and we very much appreciate your feedback about this webinar, helping us to know what to do and what to do differently and what to do to improve. And so we certainly welcome and receive your feedback. So please do complete that link. And last but not least, thank all of you that have been a part of this webinar experience. Whether you are watching it live or you are watching a recording, we thank you so very much for taking the time to be with us on a very important subject. Yes, this is May, where we recognize mental health awareness, but we know that mental health is important year round. Thank you so much for recognizing that priority because our children cannot raise themselves. They need healthy adults to do so. And want to leave you with a quote from Mel Robbins. Your mental health is everything. Prioritize it. Make the time like your life depends on it, because it does. Thank you all so very much for all that you do, for who you serve, and most importantly, ensuring that you recognize the importance of who you are and maintaining your own mental health. Until we meet again, be well. Thank you.